Mr. President, millions of Americans are starting to get notices that their monthly health insurance premiums will be going up by $100 or much more because President Trump and congressional Republicans are letting critical health insurance tax credits expire. You know, Donald Trump likes to put his signature on things, and to be fair, he should be putting his name on each of these premium increases, because there's no other way to describe it. This is a Trump health tax on working families. It's part of the Trump plan. Think about it. Trump demanded $4.5 trillion, and just to be clear, that's trillion with a T, in tax giveaways in his deeply unpopular budget. But in all of those tax cuts for billionaires, for gun manufacturers, for wealthy oil and gas companies, Trump and congressional Republicans couldn't find any room to extend the tax credits that help 22 million Americans keep their health insurance. In fact, to add insult to injury, they also cut $990 billion from Medicaid for the 70 million Americans who rely on it. Let's take a second to put Trump and Republican priorities in perspective. They passed a massive tax giveaway for approximately 902 billionaires. They slashed $990 billion from Medicaid, which covers 70 million Americans, and they decided to let health insurance help for 22 million working Americans just go away. Trump and GOP leaders are so committed to blocking anything good for Americans' health care that they are shutting down the government to prevent us from fixing the problem. That's where we are today. We all know that shutdowns are costly, wastefully, and needlessly disruptive. But not having health coverage because Republicans ended it, that's devastating. And I want to be very clear. This is about the health care of 22 million Americans, not undocumented immigrants, as some Republicans have misleadingly claimed. Those in the U.S. legally are not eligible for these tax credits, or for Medicaid, or for Medicare, for that matter. This is about the health care of American families. There is a simple path forward. Fund the government and help Americans keep their health care. While my colleagues on the other side of the aisle say we can wait to address this issue, the American people can't wait. Open enrollment for people who purchase health insurance for themselves or their families through the state marketplaces starts on November 1st. That's less than a month away. And notices are already going out the door. In Rhode Island, these notices start to go out on October 17th. And if the Republicans keep us from acting now, premiums will more than double, a 114% increase. The new premiums will be so high that many people will forego coverage. Indeed, it's likely that younger and healthier people will forego coverage, leaving those under coverage with more complicated and more expensive health care programs, also driving up the cost of health care. In Rhode Island alone, roughly 13,000 people will likely lose their health care coverage for next year because of these price increases. We need to act. Last Friday, I met with small business owners in Warren, Rhode Island. They stressed the need for this tax credit. Even with this credit, it is difficult for them to afford health coverage and keep their businesses open. One of these business people made a profound point. I call it the Uriah principle, after the first name of the proponent. And what is the Uriah principle? Simply, the most serious side effect, or one of the most serious side effects of the lack of health care insurance, is poverty. Yes. When you have no health care coverage and you get ill, you can't work. When you have no health care insurance, you are in a very difficult position and you're scrambling just to get by. That's not conducive to the initiative it takes for small businesses to thrive in this country. And my colleagues are always proclaiming their devotion and dedication to small business everywhere. This is a blow to small business everywhere. Now, it's unfortunate, but Donald Trump and his handlers don't want to solve this problem. And congressional Republicans seem only to be interested in what Trump wants. Since August, right after the congressional Republicans rammed through their $1 trillion in cuts to Medicaid and other health care programs, the Democratic leaders of the House and Senate have been asking to sit down and negotiate to resolve this problem. But at President Trump's directions, Republican leaders ignored the request. Trump said, don't, quote, even bother dealing with Democrats. And Republican leaders have listened. At one point, the president agreed to meet, but reversed course, apparently at the direction of Speaker Johnson, who has kept the House in recess for the last month. Finally, the day before the shutdown, the president finally agreed to meet, not negotiate, just meet. Since then, nothing. Apparently, he has plenty of time to host the president of Argentina and has no problem sending him home with $20 billion of U.S. taxpayer dollars. But he has no time to talk about helping the American people with their skyrocketing health care costs. While President Trump is ignoring this issue, he is demanding a blank check so he can run the government exactly how he wants to. And unfortunately, GOP leaders are willing to hand it to him. And not for the first time. Late last year, shortly before President Trump took office, Democrats and Republicans reached a bipartisan agreement on a full-year funding bill for fiscal year 2025. It would have funded the government for the entire year, and it would have provided critical disaster relief, funding for national defense, child care, the healthcare system, transportation infrastructure, and much more. But Donald Trump insisted that Republicans walk away from the agreement until he came into office so he could call all the shots. They delivered, and he took advantage. I didn't vote for the year-long CR that Trump eventually backed last March because even then, his excesses were already on full display. His wanton claims of executive powers, his firing of thousands, cancellation of grants, misuse of law enforcement, politicalization of the military, and general lawlessness were apparent. And true to his nature, under the FY 2025 continuing resolution he signed into law in March, Trump has illegally delayed or withheld federal funds for medical research, including for childhood cancer, for Head Start, for Job Corps, for disaster recovery and mitigation, for foreign assistance, including life-saving therapeutic nutrition for starving children in the world, for the Emergency Food and Shelter Program, which provides food and shelter throughout the country using the auspices of Catholic Charities, the Jewish Federation, and the United Way. He's used the so-called pocket rescission to illegally cancel $4.9 billion in foreign aid. He's even tried to close entire departments and agencies without congressional approval. To have the president sign a bill into law and simply flout its requirements like this is irksome, to say the least, particularly from members of the Appropriations Committee on both sides of the aisle. Indeed, as a member of the committee, I know how hard we work to prepare bipartisan bills every year. Some of my Republican colleagues have been privately outraged by the president's actions. A few of them have had the courage to speak up publicly. But President Trump's campaign of petty vindictiveness and hard partisan ideology continues. Trump and his budget director, Russ Vought, say that the shutdown will force them to fire federal workers. That's nonsense. From day one, President Trump, Mr. Vought, along with Elon Musk and his minions, have tried to fire federal workers by the thousands, without cause and without thought. They've terminated experts in national security and intelligence, and in some cases, they've had to beg them to return to their jobs because they were, in fact, irreplaceable. Just this past Friday, the administration fired hundreds of workers at the Centers for Disease Control and Prevention. But before the weekend was over, they were scrambling to reinstate an estimated 700 employees who work on critical issues like measles response and containing the spread of Ebola. The administration has also fired many other federal workers precisely because they've done their jobs with professionalism, honesty, and integrity, replacing them with loyalists who have little background or expertise to do the jobs they've been appointed to do. Trump has allowed his political appointees to rifle through the personal data of nearly every American. I asked the FBI director after DOGE had gone through all his data, can he assure us that that data is not in the hands of anyone unauthorized to have it? He has mumbled a response that was really non-responsive. If you stop and step back, DOGE has pilfered the data in every major federal agency, and no one can tell you where it is, who has it. That could be the greatest crime committed against the American people in the history of this country. Trump's tariff taxes are driving up costs for food, electricity, clothing, and nearly every basic necessity for American families. Small businesses are facing these same cost interest increases too. As I said, when talking to small business people in Warren, Rhode Island, they're looking at a very difficult challenge, and it's not being helped by Trump. This list goes on, as does the list of lawsuits against the administration. And for 9 months, congressional Republicans have had the chance to show some true independence, to say no to Trump on his price-raising tariffs, to say no to Trump's misuse of federal funds, to stand up to the administration's abuse of the personal data of Americans, to reject some of the least qualified and most dangerous cabinet members in history, to conduct even the most basic taxpayer oversight of the numerous conflicts of interest and money-making ventures of the president, his family, and his allies. But when their votes have mattered, they have gone along with every bad decision this president has made. If this capitulation to the executive branch continues, the Senate will be rendered a hollow, powerless body, with senators powerless to represent their constituents and states. And I would remind everyone that the iron law of the Senate is what goes around comes around. And my colleagues should ask themselves, do they want their states and constituents treated this way, the way Trump is treating his perceived political enemies, cutting off valuable public assistance to blue cities, putting U.S. forces into blue cities, military in violation of the Posse Comitatus Act? I think the answer would be no. And what's good for one side has to be good for the other side. Now, the president is not popular. What he's doing on every issue now is not popular. Costs matter to Americans in every state in this country. And this healthcare debate is all about cost. One of the ironies is some of the biggest impacts of these healthcare changes will be on the red states. Everyone suffers across the country, but there's significant suffering in places that are prominently Republican. So why are my colleagues on the other side of the aisle saying, oh, we don't care? They should think long and hard about that and remember why they wanted to be senators in the first place: to improve the lives of their constituents, to help, to serve. And that requires compromise here. We saw that last week when we passed a national defense authorization bill with overwhelming bipartisan support in very efficient and rapid procedures. When you get compromise, bipartisan compromise, you get results. When you get a body that seeks only to carry out the will of one person, you get what we have now: stalemate, sufferings by poor people who can't get health care, but great benefits to the wealthy. For the last several months, appropriators have been working on bills to protect and invest in the American people. Together, we passed 8 appropriations bills out of the committee, most on overwhelmingly bipartisan votes. 3 of those bills have been passed by the full Senate. And throughout this process, Democrats have shown our commitment to doing the hard work of government. We've been flexible and willing to compromise. And frankly, if it was in the Senate's power, both Republicans and Democrats, we would have legislation, appropriations legislation, before the president today. But we have been unable to because of the roadblocks he's established using his leverage over my Republican colleagues. In fact, I think it's fair to say that President Trump and Speaker Johnson don't really want compromise and don't really want Congress to pass appropriations bills. They want Democrats to go away and give them another blank check, another CR. But forget whether it's a CR or an appropriations bill. If the president doesn't like the program, he just takes the money away, which is contrary to the Constitution, but that's just a detail. It takes 60 votes to pass a law here in the Senate, so Democrats will be here ready to reach a principal agreement on spending and protect the health care of 22 million Americans. We're ready. We just need the president and the speaker and the majority leader to sit down and talk, not about their partisan interests, but the welfare of their constituents.